The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time to discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, and I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you're involved in a motor vehicle accident, call my office today and schedule an appointment and have an osteopathic evaluation. That's right. I've been saying for the past about 3-4 months that I am taking no-fault patients. Not every physician, especially the urgent care centers and your primary care physicians, take no-fault insurance. I take no-fault insurance. And to learn more about no-faults, what you do is go to youtube.com/Dr. Tommy O and search out my no-fault show and listen to it. And you're going to get an understanding of what no-fault insurance is and how it works and how important it is to get your paperwork in on time. Because if you're not able to get your paperwork in time, an insurance company can deny your claim, meaning it will not pay out for your medical services. So it's important. And then also you need excellent legal representation I'm working with the top lawyers in our community, and they'll help represent you and guide you through this situation here, because this is new to you, okay? It's not like regular insurance. Okay, to my military family, I got your 6. To my Masonic brothers, the light is bright. If you wait, it may be too late. Today's topic, cholesterol. All right, so before I get into today's topic, I just want to tell my wife, Baby Cakes, that I love her and that we had a wonderful vacation. You need to spend time with your significant other, quality time, because that will help reduce stress. Remember at the beginning of this year, I was talking about reducing stress and improving one's life. Spend quality time. We went away for a week, but it went too fast. It was Friday to Friday. We lost both Fridays because that was traveling, and really enjoyed 5 days of just decompressing. We need to spend a few more days, so that will be hopefully next year we'll be able to have a few more days on our vacation. So think about that. Take time off. You need me time, quality time, especially quality time with your significant other. Rejuvenate your relationship. All right, so let's get on to the topic, cholesterol. Well, you hear about cholesterol, friends and family, they have what they say high cholesterol or hypercholesterolemia, but what is that? So what we do is you come in for history and physical, and then we do routine blood work, right? That's what I always say, annual physical with routine blood work. And then we draw a lipid panel, and this panel, it breaks down into different segments, okay? You have different molecules within the total cholesterol, or what we call the lipid panel, because total cholesterol is total cholesterol. So more specific, the lipid panel. Well, what is cholesterol? Cholesterol is a waxy, fat-like material found in the bloodstream. All right, so it's going to be, like almost like a greasy, fat, jelly-type material, and it represents all. It's found in all body parts and all tissue throughout the body because we need fat, we need cholesterol. That is part of our physiology. It is produced by the liver and also extracted from foods of animal origin such as meat, poultry, fish, eggs, and dairy products. We need this material, cholesterol. It's used for essential body substances such as cell walls, right? Walls, and that's that. I'll give you an example, like your hair shiny. Well, that's why it's the fat that keeps it shiny. The protein we intake, that gives your hair your strength. Well, it's the same thing with your skin and the cells. It's also for some hormones, that would be the base molecule, and then we build on top of that, as well as you see it with vitamin D or fat-soluble vitamins. All right, so why should I care about my cholesterol? Well, cholesterol is essential for life. However, if you have too much in your blood, it can increase health risks. And we always speak about risk in medicine, okay? So let's reduce risk. Even when we low risk, there's still a chance that you can develop some sort of medical condition or pathology. But the key here is to reduce the risk. So with cholesterol, all right, or lipid panel, we aim to keep your cholesterol down, okay, within a healthy range, which I will describe in a little bit. So cholesterol travels throughout your bloodstream in protein and fat, what's called a lipoprotein, and they're in particles, okay? And that's what we're measuring, the lipoproteins. One type of particle is called a low-density lipoprotein, LDL, and it delivers cholesterol to the entire body. And this is called the bad cholesterol. Now, when you go to a doctor, they'll say, okay, your total cholesterol, your good cholesterol, and your bad cholesterol. And this is what they're talking about. They're talking about a low-density lipoprotein, and that's the molecule that is traveling throughout your body. LDL, bad cholesterol. Then we have VLDL. It starts to get complicated, but I want to keep this as simple as possible. So LDL, we're going to talk about total cholesterol, good cholesterol, and your bad cholesterol, which I just mentioned. It's LDL, okay? And then the type of particle is a high-density lipoprotein, and that's the HDL, and it assists in removal of the cholesterol from the bloodstream. HDL is called the good cholesterol. So you'll hear, someone will ask, well, what's your HDL? Okay, they're talking about what's your good cholesterol levels. A high HDL level, they're saying greater than 60 considered to be protective factor against heart disease. Now, different labs will use different reference ranges, all right, which we'll get into shortly, probably the second half of the show, because I got about 3 minutes left on the first half, and I'll discuss those levels of what's desirable. If you have excess of amount of LDL in your bloodstream, waxy plaques can build up along the arterial walls, causing arterial narrowing, okay? What do we say about that, right? You have your micro and macrovascular pathology. How does this happen? Well, we have micro tears. Every day we're under stress, and you get micro tears. Well, those micro tears need to be repaired. Well, how are they repaired? Well, you have platelets. Platelets come in and they want to fill in, and then we have the healing process. Well, within those chemical reactions in that process, you have the fat, that's the cholesterol that's traveling around the bloodstream. It gets trapped in that patch, okay? So we'll call it a patch as it's healing. And if you have high blood pressure, you're going to keep having micro tears along the arterial wall. So we keep patching it, and cholesterol builds up, and you have a plaque formation. I'll just go over the plaque formation. When I was, we used to scrub in with a cardiovascular surgeon. They would do an endarterectomy, and that's where they go into the carotid artery. We cut the neck. You'll see someone who has a scar around their neck. From not around from right to left, but it's going to be from the trunk up into by where the head and the neck attach. You'll see a scar there. And what we did was we opened up and they made an incision like splitting a banana, and then they take a special instrument and they gently remove the plaque from the artery wall because it's attached to it, and they have to be very gentle, and basically they peel it out, and it's a hard yellowish waxy substance, and that blocks the blood flow. Now what we do is we do ultrasounds. Before we do an ultrasound, I auscultate, meaning I listen to the neck and I'm listening for bruits, and if I'm hearing changes in the sound, then I know we're starting to have the diameter of the artery starting to decrease. And then I'm going to say, okay, we need an ultrasound of the carotid artery. And if you meet a certain criteria, you're going to need an endarterectomy, and that would be a vascular surgeon that will handle that. And what they will do is basically peel out that plaque, that waxy, hard cholesterol plaque, and remove it and sew you together. All right, I'm down to the last 20 seconds in part one. I want to thank my listeners to listen to my show. My anniversary is coming up in a couple of weeks. So if you need a physician, okay, you have chronic neck and low back pain, you need a primary care physician, give me a call, 631-980-8200, or go to drtomio.com, drtomio.com. I'm still accepting patients. Call me now. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time to discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. Or if you're involved in a motor vehicle accident, call my office today and schedule an appointment to have an osteopathic evaluation. All right, so let's just go over my opening monologue there, and it's important. Yeah, I have to emphasize how important it is for you to have a relationship with your physician. Okay, you need to be able to communicate with your physician. It has to be both ways. Okay, we're exchanging ideas, we're exchanging knowledge. When you have that type of relationship, we're able to, one, trust each other. Two, you're going to have compliance. And when you have compliance, you have a better outcome. That's what medicine's about. It's not about the pill. Anyone can prescribe the pill, but do they know what they're doing? No. You need to be able to communicate. You need to be able to listen. In today's medical practice, it's 5 minutes, one complaint, in and out. The doctor's not listening. The doctor has to just push through, get you in and get you out, move on to the next patient. Not in my practice. I take my time and I listen to you. My patients love it. Now, just look on my website. If you go to my website or go to youtube.com/Dr. Tommy O, you will see video testimonials, not written testimonials. I have those. Everyone has those. But literally, I have video testimonials of my patients talking about their experience with Dr. Tommy O. I treat my patients like family. I want you, my listeners, to become my family. Come join my practice. If you have chronic neck and lower back pain, come to my practice. I'll take care of it. Why do you need to have a separate primary care physician and go to a chiropractor? That's me. I'm an MD and a chiropractor combined. That is what an osteopath is. Chiropractic came from osteopathy. So come to me. I will care for you. I will give you that quality care you deserve. All right. So like I said, come join my practice. Let me help you lead a happier and healthier life. If you wait, it may be too late. Now, I finished off part one with what I described as an endarterectomy, and that's where you have the plaque formation building up in the carotid arteries. But we can have plaque formation build up in any part of the body. I described in my diabetic shows about the micro and macrovascular pathology, and that's where you have the plaque formation building up. You have decreased blood flow, we have decreased nutrition, decreased oxygen to the tissue, and eventually tissue death, or what we say, structure is function. Without proper structure, there is no function or dysfunction. Well, the structure is changing, and we eventually work our way into dysfunction, and we have tissue death, okay? So we're trying to prevent that. We want quality of life. All right, so we were talking about the endarterectomy and scrubbing in and seeing this plaque, this hard substance. Literally, it's hard. It's a hard, waxy substance. So when they remove it, the cardiovascular surgeon have to be very careful because we don't want any of that breaking off. So they'll take it out and remove it, and they will sew it back up, and you have better blood flow to your brain. You'll feel a lot better. You feel energized. You won't feel fatigued. Blood pressure, you'll have will reduce risk for having strokes, because if we don't have blood flow going to the brain, you can have a stroke, and that's what we have, the plaque formation. There's two types of strokes. You have a transient ischemic attack, a TIA, and that's what I'm just described there, where we have a blockage and you do not have blood flow going to the tissue, and then you have tissue death. Then we have what's called a hemorrhagic stroke, where actually under pressure the artery in the brain ruptures, and then we bleed out. When we do a scan of the brain, we'll know if it was a hemorrhagic or a stroke, because on the scan you will see darkening, and that represents the blood. Okay, so let's continue. So we'll get into what are triglycerides. Again, we're looking at the lipid panel, and the panel is broken down into different particles. And so we discussed there's total cholesterol, we have LDL, bad cholesterol, HDL, good cholesterol. Now I'm going to talk about triglycerides. And triglycerides, it's a common form of fat found in the body and foods. Triglycerides attach to lipoprotein particles in the blood. And now they're finding that with a high triglycerides or triglyceride levels, that there's an increased risk factor for coronary heart disease. So what we need to do is we need to pay attention to diet. All right. So testing recommendations. Now, the testing recommendations have changed. These insurance companies, they get involved because they're bean counters and they're trying to keep the cost down. And so I was reading last night the recommendations, and I definitely don't approve of those. Every year, annually, history and physical should have a lipid panel. Get a baseline, and we know where you stand, and we should address that. Okay. So now I go, boy, it's only about 3.5 minutes left. This is crazy. That's how fast it goes. So, like I said, every year, annually, get a history and physical and a lipid panel. And depending on your panel will determine how often we need to follow up. So if you have a normal lipid panel, everything's fine. Your total cholesterol, good cholesterol, bad cholesterol, triglycerides within normal limit, we can say, all right, I'll see you in a year. However, if your panel and your cholesterol, those particles are elevated, we need to sit back and discuss the appropriate treatment, appropriate care. Now, for me, typically, I take a conservative approach, and we'll start off with diet modification, weight reduction, and then we will repeat in 3 to 4 months and see if there's any change. If there's a change and I'm seeing a downward trend, this is good. And I would say, well, I will see you in 4 months, continue with the diet modification, modify the diet, get into an exercise program, repeat it. If I keep seeing a downward trend, this is good. We're going to continue this naturally because I am teaching you how to do things healthy. All right, so recommendations, all right? So, or desirable levels, I should say. Total cholesterol, it is suggested that we want 200 or less. That is desirable. Now, if you go back in the early 2000s, they were trying to push the family practitioners to push out patients less than 180, and there was pushback. We said 200 is good. 200 to 239, they're claiming now this is borderline high. And if you're greater than 240, that is high. Now, there's also, how do we get high cholesterol? One is your diet, also your DNA, your genetics. We can have what's called familial hypercholesterolemia. All right, that's based on your DNA, your genetics. And I've seen cholesterol levels as high as 600, 700, 800. Your body's just producing cholesterol plus your diet and what you're taking in. So what do? Diet modification, and we put you on medication for something like that, because in that case, we have fatbergs floating around your bloodstream, and you see the damage that an iceberg did to the Titanic. So imagine what a fatberg and the damage that it will do in our body. Very important to get the total cholesterol and figure out where your baseline is. LDL cholesterol, we want you less than 100. So if we're looking to get that down, less than 100. HDLs, this is your good cholesterol. That LDL is your bad cholesterol. Bad cholesterol, we want less than 100. HDL, good cholesterol, we want you, depending on the lab, I was taught higher than 40, they're recommending, and they're pushing up to 60. But that depends on genetics. Men, very, very difficult for us to have high HDLs because of testosterone. Testosterone is not cardiac friendly. And testosterone, especially people who take testosterone supplement, the hormone replacement therapy or taking steroids for bodybuilding, your HDL will decrease and your total cholesterol will significantly increase. Estrogen for women, that is cardiac protective, and women's good cholesterol could be as high as 100. Yes, that's really protecting them. Triglycerides, you want less than 150. So how do we do this? Diet modification, weight reduction, watch your diet, listen to my cholesterol radio show. Again, you can go to my website or you can go to youtube.com/Dr. Tommy O and listen. I'm going to teach you about diet modification, getting those cholesterols down. All right, so come and join my practice. Go to drtommyo.com. That's drtommyo.com. Make that call today.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.